Hi, my name is Erin. I know I look totally normal, but I have conditions called Chiari malformation and Syringomyelia. Big words, right? Because you can't see what's wrong with me, people sometimes don't understand what I'm going through. I want to tell you a little bit about my story. Over the last few years, I wasn't feeling so well all of the time. I had lots of headaches and I would get dizzy. It was hard to focus in school or play with my friends. I had to see many doctors to figure out what was going on. It was hard telling my story over and over again. I had to have an MRI, where you lay on a bed and a big loud machine takes pictures of your brain and spine. Cool, huh? The doctor showed me pictures from the MRI. One was of my brain and one of a normal-looking brain. This is a normal-looking brain. This is my brain with Chiari malformation. With Chiari, the lower part of my cerebellum hangs down through the opening of my skull. Because of this, my spinal fluid does not flow freely in my head and spine, kind of like a clogged pipe. This causes many symptoms for me. I have headaches, neck pain, and weakness in my arms and legs. Many other people with Chiari also have dizziness, ringing in the ears, choking, and imbalance. My doctor said that I also have a related disorder called Syringomyelia. This is a fluid-filled cyst called a syrinx in my spinal canal. It's kind of like a blister. Because of its location in my spine, it is causing the numbness, tingling, pain, and weakness in my arms. I never know how I will feel each day and often miss a lot of school and fun time with my friends. It is also hard when I miss school because I have a lot of doctor's appointments. I am glad that I have met many new friends with Chiari in the waiting rooms. My doctor said that every single patient is different. We also have many other conditions. The names are like alphabet soup. Sometimes, doctors suggest that kids go to physical therapy and use medications to help them feel better every day. For some patients, surgery is necessary to stop the symptoms from getting worse. The surgery has a big name, posterior fossa decompression, but I can tell you that they take away a little bit of bone in the skull, and they sometimes open up the dura, that's the lining around the brain, so the spinal fluid can flow freely. My friend Johnny was in the hospital for 3 days and was able to go back to school after a month of recovery. My friend Jamie had to wear a cervical collar after her surgery. Sometimes recovery takes a lot longer. I was in the hospital for 7 days. After a month, a tutor came to my house so I could do my schoolwork at home. My sister Jill also has Chiari, but she doesn't need surgery. Because we are all unique, we each have a different experience with Chiari, and our doctors prescribe different types of restrictions at school and at home to keep us safe. Because this is an invisible illness, sometimes it is hard for teachers and friends to remember that Chiari is a serious condition. I hope that this helps you understand a little bit more about Chiari and Syringomyelia. If you have any questions or you want to know more, please ask me. I'd be happy to tell you more about it, or you can learn more at csfinfo.org.